So I understand you're having lots of hot flashes.
I am, yeah.
Like all day long and night and everything like that?
No. Some are better. Some days are better than others. But multiple times.
Multiple times, okay.
Mostly during the day and when I go right to bed.
Okay.
I mean, it's going to give me 5 minutes in bed and...
Really? That much? Okay.
That's it. But then I do sleep all night.
Good.
That's I do.
Very good.
Yeah.
But you wake up then with a hot flash in the night or not?
I used to, but I don't do that too much anymore. Sometimes.
Okay.
Sometimes.
How about, are you cold? Like, do you say...
Never.
Okay, you're not cold.
Never.
Okay. Because your thyroid's not working very well either.
No, I'm not ever cold.
Okay. How often do you exercise?
I used to. October, I was 3 or 4 times a week.
Okay.
Yeah.
What
happened in October? Became frustrated.
Okay.
I'm frustrated. The weight's back up there. I wasn't seeing the results, right. And I just became frustrated.
Okay. I'll explain to you why you couldn't lose weight and why you can't lose weight with this hormonal imbalance. I'll go through all that with you.
All right.
And at the end you'll say, I wonder why I couldn't lose weight. I'm, way out of balance.
Yeah, I was very frustrated.
And I even tell people, if you're having hot flashes, you're gaining fat. You're making more fat. That's your body saying, hey, I don't like this estrogen situation. We need more estrogen. And the only way, since the ovaries aren't contributing to it anymore, the only way you can make estrogen is by making more fat tissue.
Okay.
So you go, well, geez, I'm going to exercise more, I'm going to eat better, and your body says, whatever you want to do, you do. We're making fat in this house. We are making fat. You do what you want. Okay? And you're like, well, that doesn't sound fair. Like, hey, that's it. We want estrogen, and that's what it's demanding you to do. Okay. And this FSH, and we'll talk about that. FSH is the pituitary. Okay, there's way back between the eyes at the base of the skull is the pituitary, and that does all kinds of things. But one of the things it does is it watches your estrogen levels. By the way, it's been watching your estrogen levels since you were in utero.
Really?
Since you were a child. Since you were an adolescent, since you were going through puberty, since you were in your teens, since it knows you perfectly, Now, here's the problem. When you start to get into your late 30s, 40s, now the brain is like, what will happen in the 20s when that FSH is like 3 to 6? You go, that's a nice low number, and basically the brain would say to the leftover, hey, would you mind ovulating this month? Sure, no problem, I'll take care of it. You ovulate. The next month, it goes to the right side. Hey, right side, could you ovulate? Yeah, sure, I'm happy to do that. And it's a nice, congenial conversation. As you approach your late 30s and 40s, what happens is your brain says, hey, leftover, could you ovulate? No. I've been doing this long enough. I don't want to do it anymore. Go ask the other side. And then the brain starts getting mad, and the FSH starts rising. It's like going, this is not acceptable. So the FSH starts to rise. So, ideally a 3 to 6 is a nice level. When that thing starts reaching 25, 30, now you're starting to form lots of fat. When it reaches 40, the FSH is 40, your body is basically cranked up and you're having hot flashes. Okay? Yours is 91. So wonder why you're having hot flashes that much.
Have you had a hysterectomy now? Haven't?
No.
Oh, no, you haven't.
Then she asked about a hysterectomy, and that's another. I mean, that's a tumultuous catapulting into menopause.
Right.
But yours was potentially a little more gradual. But it would, especially when they do a hysterectomy, where they take all the ovaries and they put it in a bucket and say, "Good luck." I've had patients that they literally say, "Oh, you don't have any hormones," and these people literally went into profound depression because they're walking around with estrogen levels of 400, 500, and next thing you know, it's 0.
So is that why? Because mine, you said it's at 91.
That's your FSH. That's your brain.
Where does it want to be?
Well, it wants. Yeah, it's a good question. Where does your brain want? It liked it when you were in your 20s.
Okay.
And the question is, so what is the perfect estrogen for you? One way I determine that is by watching your FSH come down. Or it'll kind of level out. Okay. If it goes up, it means I'm not doing a very good job. You need more estrogen.
Okay.
Now, let me tell you how the gynecologists do this. You walk into your gynecologist's office and you go, I think I'm in menopause. And they say, well, let's check your FSH level. And they come back and they say, it's 30. And they go, no, not in menopause. And you go, okay. So you come back 6 months later and you say, I think I'm having hot flashes. And they say, well, let's check your FSH level. And they say, oh, you're 60. You're in menopause. Oh, by the way, here's a sticker for your refrigerator. That's it. They go, have a nice day. You're in menopause. And you're like, if my brain's not happy with this, why shouldn't I maintain these estrogen levels to make my brain happier? Right?
Well, and my doctor did give me...
Premarin?
Progesterone.
Yeah. We did the hormone replacement
Prempro?
therapy.
Prempro?
I don't think it was Prempro.
Okay.
No. But it didn't do anything. I saw no significant relief at all.
Okay.
None.
Was that a cream or that's an orally?
It was oral.
Okay.
We tried the cream first, then we went oral.
One of the problems with that, and we'll go through this in more, I have a different perspective on estrogen. I don't believe estrogen in your body, in your bloodstream, causes breast cancer. I believe estrogen in your breast tissue, excessive estrogen in your breast tissue causes breast cancer. But not high estrogens in your bloodstream, because if that were true, when you were 26 years old, you should be riddled with breast cancer, right?
Right.
When you had an abundance of estrogen in your bloodstream.
Right.
By the way, 80% of breast cancers occur after menopause when your estrogen levels are lower than they were since you were 7 years of age.